Now, his other issue he's got, you may notice this tearing, that brown staining that's on either side of his eyes there. This is a very common problem in dogs who, again, are brachycephalic or have the short faces. Many people think it's just a foregone conclusion. There's nothing you can do about it. That's just how they're born. And there's all sorts of eye drops and supplements and things that are made to improve the staining, that brown, but none of them improve the tearing. And so the problem with this is that there's a reason why they're tearing, and it's multifaceted. First, some of it is just because of the shape of the face. The ducts that drain the tears out of the eyes, the nasolacrimal ducts that drain down into your nose and the back of your throat. That's why when you cry, your nose runs, and those are literally tears coming out of your nose. That in these guys is smushed a little bit, and so we can't fix that. But the other thing that's happening is that his eye openings are just way too big. I can see the whites of his eyes all the way around his eyes like that. That's way too big, which allows his eyes to sit more forward. That not only increases the exposure on his eyes, and so his eyes are constantly tearing because they're getting exposure. Things are getting in them, just even the wind. You know, if you've tried to open your eyes on a windy day, like your eyes start running, it hurts. But also, and most importantly, when he sleeps, his eyes will not stay open. When you go to sleep, that's an active process to close your eyes. But when you are asleep, it's now a passive process that your eyes stay open. You don't think about keep your eyes open while you sleep. So what happens is that because his eyes naturally push forward, they are pushing against those eyelids and actually pushing the eyelids open. So now his eyelids are cracked open and his eyes are literally feeling a draft all night. So what do they do to respond? His eyes try to protect them the only way they know how, by producing tons of tears. So what we're going to do with him is that we're actually going to close down his eye opening a little bit. And you can do it either from the outside or from the inside. Most of these smush face guys will actually benefit from doing it on the inside. Their tear ducts are far enough away from the corner of the eye that you can do that. For some of these guys, though, we just do it on the outside. So we'll see once we get him under anesthesia which way we go. His eye will still look totally normal. It'll retain a little more of a kind of an almond shape rather than being kind of a perfect circle. That'll allow his eyes to stay closed while he's asleep. The tearing will go away. More importantly, his eyes are going to be protected long term, and his tear glands aren't going to get exhausted. A lot of these guys, because they're overproducing tears, end up with dry eye as they get older. And so we're going to keep that from happening as well. So we're going to get him under anesthesia in just a few minutes and get him all fixed.